Continuum of Care membership, and I'm excited that we do have some new voting members. We don't have new members this month, so I will say, if for all of you out there, continue to do what you can. If you know of other stakeholders that should be at the table, the more stakeholders, the better for the strength and performance of our system, for all different types of partnerships. And then also, for those of you that may not know, to become a voting member, you need to indicate that you'd like to become a voting member and attend 3 consecutive meetings, and you can coordinate those logistics through David, or send an email. You see the coc@rivco.org email. You can make sure that you communicate with David on that. I would like to introduce and announce the new voting members. Homemade Inland Empire, do we have anybody from Homemade with us here at the meeting today? Okay, well, they are a new voting member, as well as First Five. Did we have a representative from First Five today? Okay, Mount San Jacinto College. Anyone here from San Jacinto College? Well, I know we have Kimberly from Norco College. Kimberly, would you like to say something? We're so thrilled to have you at the table. You're a great partner, and a shout out to you for working with us this year in the Account of the Homeless to do a targeted effort on homeless youth. Would you like to say a few words as one of our new voting members?
Thank you so much, Karen, for inviting us to the table. Norco College is committed to providing support services for our students. That includes housing, resources for our unhoused students, just a variety of things to help our students live their best lives. And this continuum of care helps us do that. So we're looking forward to strengthening our partnership, and we appreciate being a voting member of the group now. Thank you.
Thank you so much. Welcome again as an official voting member. And I love your background, by the way. Just looking at it makes me feel happy. That's a beautiful background. Okay, let's go ahead and move on to the next section of the agenda. Agenda item number 2, consent items. We have on consent the April 26, 2023 Continuum of Care meeting minutes for approval. I would like to call for approval of the minutes. And if you have any abstentions or or objections, please let us know. Do I have a move to approve the minutes?
I'll go ahead and move to approve the minutes. Kim from Labor of Love.
Thank you, Kim. And do I have a second?
This is Angelina Co. I'll second.
Thank you, Angelina. Any abstentions or objections?
I'm abstaining because I haven't been here for a while.
Okay, thank you. By the way, Gina, it's so lovely to have you back. We were just talking about how we missed you the other day, so thank you for that. So David will
still a voting member. I haven't been gone so long.
David will coordinate with you offline for that, but he'll make a note of your abstention. So thank you, everybody. I think with that, the item passes. And we can move on to agenda item 3, which is public comments. At this time, members of the public or the continuum of care can address us for anything that is not on agenda. Are there any public comments, or David, did we receive any written comments?
We do have a public comment, and at this time I'd like to turn it over to Maria. Maria, are you on the line?
I am. Thank you, David. I'm having trouble with my camera, so it's not intentional. But I just wanted to put this out there on behalf of parents here from the Riverside area. They are looking for their teen. She's been missing for more than 70 days. And just trying to get connected with resources. I was able to provide a few resources, but I just wanted to share this with anyone out there who may be doing outreach. If you come across Autumn, please contact the local PD. Thank you.
Thank you so much. Are there any other public comments? Okay. With that, we're going to move on to the next section of the agenda. We're going to take things out of order to accommodate some schedules. I appreciate you guys working with me on this. We're going to move to agenda item 4.2, and I'm excited that we have an update on the Mental Health Services Act active 3-year plan. So we have David from RUHS. David, the floor is yours for the presentation.
Thank you very much, Madam Chair. Thank you for having me today. I was one of the folks affected by kind of the confusion regarding time. So I'm going to apologize in advance if I go a little bit more quickly than I planned, just to make sure that we get everything kind of done on time. I do have a meeting that I need to attend to at 4. But my name is David Scholin. I'm the Mental Health Services Act Administrator for Riverside University Health Systems Behavioral Health. And essentially my job is like a compliance officer, making sure that the department complies with its regulations in order to be able to access the funding in this dedicated funding stream. If you haven't heard about the Mental Health Services Act, you're in a good place right now, because I'm going to give you a little update regarding the history of the Act and a little bit more about kind of its foundation and what it's all about. And in addition, today, we're going to talk a little bit about some of the planning that's occurring in Riverside and how you can be a part of that. My assistant, Selena Contreras, is going to be helping me today, so you're going to hear me ask her to switch to the next slide. She's going to be kind of like the man behind the curtain and helping me get through all those kinds of things. So what is an MHSA, or MISA for short? It was a proposition on the 2004 California ballot that became law in 2005. It created a 1% tax on millionaires to generate a dedicated funding stream specific for the transformation of the public mental health service system. Because the economy can change over time, impacting people's incomes, so can the amount of money that is collected under the MHSA. Counties are required by law to spend their MHSA funds within 3 years of receipt, with certain exceptions, or the money reverts or goes back to the state for redistribution. Riverside has a history of a very low reversion rate. Regulations also allow for the county to create a prudent reserve or a rainy day fund. So on those times when the economy does take a dip, that we don't have to interrupt our services, because we have some money that we can draw from in order to make sure that we sustain their implementation. You can go on to the next slide. But MHSA has rules. It's not just a free pot of money that the county can use any way that it wants to. MISA has regulations on how the money can be spent. In most cases, funds cannot be used to pay for services in institutional settings, so like acute psychiatric hospitals and or in detention. Again, there are some exceptions to those, but that's the basic rule. It's one of the reasons why we can't use the funds to build a new psychiatric hospital. It's restricted based upon those dollars. The funds cannot be used to support existing state or county funds for mental health services. This means that MHSA funds cannot replace a funding source that was in place back in 2004. MISA regulations also include a mandate for a community program planning process around the MISA funds, one of the reasons why I'm here today. Go on to the next slide. MISA mandates that the counties involve the community's perspective in MISA-funded programs development. It also mandates that counties provide education on MHSA, much of what I'm doing today. This process is called the Community Program Planning Process, or more commonly known as the stakeholder process. A stakeholder is anyone who has a vested interest in county behavioral health care. The state reviews our compliance with our community participation process, and we just had our recent review in November of 2022, and the state reviewers are very positive about Riverside's stakeholder process, especially the adaptations that we had made during COVID restrictions. MISA plans come in a 2-year variety. One of them is a 3-year plan, and the other is an annual update. 3-year plans work much like a treatment plan where we spell out goals, and an annual update is a progress report showing what kind of progress we made on those goals. This year is a new 3-year plan that would take effect in this upcoming fiscal year in 2023, so July of 2023. All right, so the The department program development is an ongoing process all year round, and because of that, MHSA feedback is welcomed and accepted all year round. Information provided by stakeholders informs the vision of the department leadership on a daily basis. This feedback process is formalized during the first part of the calendar year. Our primary stakeholder groups are those under the Behavioral Health Commission and the regional mental health boards. These include subcommittees that target the homeless, veterans, children's, adults, and older adults. And we also have advisory groups within our cultural competency unit that serve and address the needs of underserved cultural populations. And move on to the next slide. By county, by law, the county must look at other funding sources first before using MHSA dollars. In other words, MHSA dollars have to be the funds of last resort or fill in the blanks when other funds aren't available. This usually creates braided funding streams, just much like a hair braid, combining funds from different areas to create a single budget for projects and programs. It's the reason I don't envy our fiscal folks, because they have to know the regulations of all of those and make sure they line up really neatly when they're funding a program. Public behavioral health has several funding streams besides MHSA, which also have their own rules and regulations. On to the next one. The programs in the MISA plan are primarily rolled over from year to year into the next plan in order to prevent service disruption. Yet community voices and research data can result in the expansion or reinvention of programs, the termination of programs, or starting or trying out new programs. Go on to the next one. So what is the MISA plan? Essentially, it's like a 500-page report that I get to write and edit. So that's why this time of year you can see me a little bit having less hair than I normally do. It describes the MISA-funded programs and their outcomes. The report is used by the state to confirm that Riverside's MHSA expenditures were authorized by the county's Board of Supervisors. It also records and documents our compliance with the laws and regulations for state and community review. But it's not meant as a guide to services because, as stated earlier, all services operated by the department cannot be funded by MHSA. So this is the frame of what the law actually looks like. It has 5 components. Each one of those components is geared to a different part of the public mental health service system. So that's the foundation. We're going to move into a little bit about what each one of those components looks like and some of the updates within Riverside County. We can go ahead and move on to the next one. Community Services and Supports, or CSS for short, is the largest of the components. It receives essentially 76% of MISA funds. It's designed to meet the needs of each age group: kids, transitional age youth, adults, and older adults. The funds are used to help meet the treatment needs of people when those funds cannot be met by other funding sources. CSS expands services to include all levels of peer support, to pay for evidence-based practices, which were typically too expensive to bring to the public sector. It helps fund our crisis system of care, including our mobile crisis teams and the mental health urgent care centers, helps fund our collaborative courts, our homeless programs, and establishes a full service partnership program, which is a high intensity case management and therapeutic program. Oh, there you go. I enrolled in Triple P parenting classes. My son was always depressed, annoyed, disquiet, in pain, afraid, and disconnected from everyone. It does work. My relationship with my son improved dramatically. Now my son hugs me, shares his feelings with both my husband and I. He has been free from hospitalizations and has been drug-free for almost a full year and is doing great. I was a mother of a teenage son, supported by the Parent Support and Training Program, which is funded in our CSS component. On to the next slide. So what are some updates for this year for our community service and supports planning? Again, these are just kind of snippets of things. It's a 500-page document, so there's a lot of material in there, but here's just some of the highlights. We've improved our outreach and engagement to clients in acute psychiatric hospital care settings by establishing outpatient service liaisons from our FSP programs that wrap around those folks while they're still in the hospital or they're still in those acute care settings, so that the team begins working with them prior to discharge and encourages and engages them in that linkage to outpatient care. We have provided assistant outpatient treatment as a part of Laura's Law for consumers who present as a danger to self or others and who have had difficulty utilizing voluntary behavioral health care services. The department's New Life clinics are the primary providers for Laura Law consumers. We have developed more new apartment units with supportive services for homeless consumers who have severe mental health challenges. In 2023, a total of 63 dedicated units are planned in Riverside and 30 units in Corona. And we expanded our parent support and training program to include a new social emotional wellness group for children, a new curriculum specifically for fathers, and the development of parent partners in our juvenile justice system. All right, move on to the next one. The next component is prevention and early intervention, or PEI for short. PEI is the next largest component of MHSA. It receives about 19% of MISA funds. PEI is unique in that it provides education and engagement to the general community, whereas CSS is designed to address service needs of people with serious mental illnesses. PEI programs are designed to reduce stigma related to seeking behavioral health care, reduce discrimination against people who carry a diagnosis, and to provide services that could prevent the onset of a serious mental illness. PEI can also fund early intervention services for people with symptoms experienced for less than a year, who do not meet the criteria for a mental health diagnosis, or who can benefit from low-intensity short-term interventions. At least 51% of PEI funds must go to programs for youth and their families. Riverside's work plans are concentrated areas of need were identified and developed by using feedback from community focus groups in conjunction with a review of related regional risk and outcome data. And there up on the screen, you can see the 7 different work plans as they define the programs in our PEI plan. You can move on to the next slide. Pearls opened up so many doors. I know how to feel and what to say. I learned so much, like how to deal with rejection. All the thoughts in my head were like cobwebs, but through this program, I have learned to do the problem list, write them down on paper, name the problem, and learn to dissect every problem one by one. That's a quote from a participant in the program to encourage active, rewarding lives for seniors, or PEARLS for short. It's a home-based program designed to reduce symptoms of minor depression for people over 60, and it's funded through PEI Work Plan number 5. And some updates in the PEI plan. Community mental health promoters, who are people from underserved cultural populations who outreach their respective communities, are a part of this plan. And last year, even with some COVID restrictions, the promoters engaged over 7,000 members in virtual and in-person formats, delivering presentations on mental health topics that range from understanding trauma all the way through to understanding major diagnoses like schizophrenia. As a part of the Suicide Prevention Plan, the Suicide Prevention Coalition partnered with the Trauma Intervention Program, or TIP. This is a program of specially trained volunteers who respond to families and victims following a traumatic incident. PI was able to add specific training and materials to support suicide loss survivors, because we know that family and friends of survivors of suicide are also in a high-risk population for their own suicide attempts. Based on stakeholder feedback, PEI will expand the use of Guiding Good Choices, which is a parenting program targeting parents of middle school and youth countywide to support improved parent-child relationship and prevent substance use. We move on to the next one. The next component in MISA is WET, or Workforce Education and Training. The authors of MHSA realized that all this MISA planning and programs were just words on paper without caring practitioners to implement them throughout the community. Our current challenges with workforce shortages, I could say that, have exemplified that problem. WET was designed to address the recruitment, the retention, and development of the public mental health workforce, and to help our allied professions better serve people who carry a diagnosis. Wet funds were originally time limited and they expired in 2018. Wet programs can continue using a portion of the dollars out of the CSS component. Riverside's funds a central wet team that coordinates and implements the wet plan. This includes the development and coordination of behavioral health training, partnerships and affiliation agreements with schools, colleges, and universities to support behavioral health care pipelines and internships, and provides coordination and implementation of loan assumption, stipend, and tuition reimbursement programs. Go on to the next slide. The placement itself was challenging, but looking back, I'm glad I was in an environment that forced me to learn and to think on my own, because the program prepared me for what to expect after I graduate. Overall, I am thankful for the supervisors that taught me the skills I needed, pushed me, and most importantly, believed in me. And that was a quote from one of our Master of Social Work student interns placed at an RUHS program, the Lehman Center, which is funded under MISO Wet Work Plan number 4. And some wet progress. Wet continued to develop and refine the supporting infrastructure to bring evidence-based practices to our clinic. Some of the evidence-based practices include dialectical behavioral therapy, trauma-focused cognitive behavioral therapy, and eating disorder treatments for both youth and adults. The department has trained over 400 clinicians to practice these modalities. Our newest addition in our evidence-based practices is eye movement desensitization and reprocessing. Stakeholders requested that we add this particular EMDR program to our service delivery system. I'm happy to note that we had just completed the initial training of 30 clinicians department-wide. You move on to the next slide. The next component is innovation. The innovation component is funded using dollars from both the CSS and PEI components. The dollars are set aside by the state and then require an additional approval process to access them. Riverside's only current innovation plan is Help at Hand, formerly known as the Tech Suite. This is a multi-county plan that explores the use of modern technologies and smartphone applications to assist consumers in their recovery. MISO administration is currently in the process of developing new innovation plans, and we aim to have one approved by the first half of 2024. The next one. Technology has been a scary T word for me, a 70+ consumer who is often triggered by the thought of doing anything that is based on technology. Yet the idea of having a peer support program and an app was too irresistible. It's a quote from a participant in one of the Tech Suite program pilots called A for I, which is a part of the technology suite. This particular application serves as a digital support for emotional wellness for people who experience psychosis or are diagnosed with schizophrenia. Tools include helping the user discern between environmental sounds and auditory hallucinations. We move on to the next slide. As indicated, we only have the one current innovation plan, and in some of its updates, it not only has piloted the new A for I application, it also has promoted a new outreach campaign based upon a website geared specifically toward men called Man Therapy in order to reduce stigma for men to seek behavioral health care, as men are in a high-risk population for not only suicide attempts, but are one of the least likely groups to seek care when they need it. Okay, go ahead and move on to the next slide. The next component is capital facilities and technology. It is the final component. It's used to fund buildings or electronic technology to support the infrastructure of service delivery. And funds haven't been around in this particular component since 2014, but again, portions of the CSS component can be used to fund new projects. Some of the more recent completed CFTN projects are the ones listed there on the side: Roy's Desert Oasis, the Arlington Recovery Community, the Mental Health Rehabilitation Center expansion, and the Restorative Transformation Center. We move on to the next slide. Current plans in the CFTN plan include the renovation of the Riverside permanent housing called The Place, The Place is a 25-bed supportive housing property with 24/7 on-site supportive services for chronically homeless consumers in Riverside. Renovation will increase bed capacity from 25 shared beds to 33 individual room beds. It'll increase the group space and common areas so that there's be more areas for facilitation and outreach. And we should be able to serve a greater number of consumers as a result. Completion is expected in around December of this year. This is also one of the funding streams for the wellness villages. RUHSBH Wellness Village models will sustain a full-service behavioral health campus that serves as a safe, monitored, and therapeutic community and living space while simultaneously delivering high-quality person-first treatment for behavioral health. The villages will be architecturally designed and landscaped and offer a full continuum of behavioral health care in one location. The goal is to build a wellness village in each of the 5 supervisorial districts. RUHSBH has initially identified 2 locations, Hemet and Coachella. The space originally found in Coachella did not receive final city council approval, and RUHSBH is still pursuing collaboration with the city of Hemet. And that completes the updates on the components. So what's next? Oh, there you go, that one. Missing regulations include that a draft of the plan be posted for community review and comment. That draft is currently posted. It just posted on the 22nd, just Monday of this week. The draft of the new 3-year plan is posted and ready for review. And I'll show you how to be able to access that by the end of this presentation. A copy of last year's plan and a lot of the historical plans are also located on the same site in both English and Spanish. Following the 30-day posting, there is a public hearing which gives the community an additional opportunity to express their thoughts regarding the programs funded in the MISA plan. Move on to the next slide. Public hearings were traditionally a single in-person 2.5-hour event. But during the COVID gathering restrictions periods, an alternative virtual method was developed with input from our Behavioral Health Commission. This included creating videos of the public hearing in both English and Spanish that were posted on department social media and available to the community 24/7 over a period of 2 weeks. Community members provided feedback using an electronic form on the department's webpage or via a dedicated hotline voicemail for those who preferred to speak their feedback instead of writing it. And next slide. They were very successful. As you can see, at its greatest capacity was in 2022 when it was seen by over 23,000 people countywide. Go on to the next slide. So this year we are creating hybrids. The public hearing will be a hybrid of traditional and virtual methods. Those videos, which I have now nicknamed Public Hearings in Your Pocket, will be posted from June 19th to June 30th in both English and Spanish again. The English ones are also have video and video sign language interpretation. And additionally, we'll have in-person hearings in each one of the regions during the same period during the early evening hours. And I'm proud to announce those dates have already been selected as well. The Western Region 1 here in Riverside will be taking place, or for Riverside, the western end of the county, will be taking place in Moreno Valley at the Moreno Valley Conference Center on Tuesday, June 27th. There will be a forum from 3 to 5, which will allow the community to stop between education stations of these different components in order to receive as much information as they would like about the plan. And then the actual public hearing will begin at 5:30 till 7 p.m. For folks to be able to give their feedback in that formalized setting. That same arrangement has also been arranged in our Mid-County region, and that will be on Tuesday, June 20th from the same hours at the Southwest Riverside County Association of Realtors Event Center, or the SRCR Auditorium in Hemet. And then the location in Palm Springs is still to be determined, but it will be on June 29th. So if I go through all this process and provide feedback, what happens to my feedback? By regulation, the MISA public hearing is conducted by the Riverside County Behavioral Health Commission. The commission is an advisory body composed of volunteers appointed by the Board of Supervisors who work in conjunction with the department to ensure citizen and professional input in all aspects of department services. All community feedback to the MHSA plan is reviewed by the Behavioral Health Commission for a response. All comments and responses become a chapter in the final MHSA plan, and the final plan is then sent to the Riverside County Board of Supervisors for approval and review, and upon approval, the plan is submitted to the State Department of Healthcare Services. All right, so move on to the next slide. This is how you can find all of this information that I've just kind of fire hosed you with today. The department's website is at a place where it's currently being updated, but it pretty much still looks like this. This is the central landing page for the department's primary website. It is transferring over to the RUHS website, so all of our RUHS partners, all of those partners will be under one website, but you can still find the department's stuff here. And you'll see that at the very top of the page, there is an MHSA index. If you tap on that, you get a sub window, and at the very bottom there, you'll see one that says plan update, and that's the page that you're going to want to get to. Yeah, move on to the next one. And this is what the page looks like a little bit. It's a little bit different right now, especially for this time of the season, because it has all that information on it that I just mentioned. But over there on the quick links, you can see all the historical plans and all the information in both English and Spanish. There's also some stakeholder participation documents there. And the center of that page gives all this information that I just described to you regarding the dates and times and the locations. It also has the draft plan, so you can click on a button and see that. It also has an electronic feedback form, and it has that hotline phone number that if folks who aren't comfortable writing have another option to be able to provide feedback. All located in that one single space. All right, we move on to the next. And this is me and my team. So if you want to be on our distribution list, get more information about any of those programs or services, we're happy to add you to our distribution list. You can see the main MHSA information there at the top, and then my information. And then for each one of some of the components have their own managers. So for prevention, early intervention, it's Diana Gutierrez. For workforce education and training, it's Nisha Elliott. And we need to update the slide on that last one. We have a new innovations manager. Her name is Michelle Downs, and she also serves as the department's cultural competency manager. And if you move to the last page. It's the thank you page. So thank you everybody for having me today and let me be able to give you as much information as I can in this time period regarding MHSA. I'd be happy to answer any questions that you may have for me today. I encourage all of you to participate in this stakeholder process, to go to those links and to be able to click and give feedback. And there's also highlight documents on that page. So if you don't want to read a 500-page document, there are some summary documents on that page as well that kind of will give you a nice clean picture. We call it the MISA Toolkit. It's again, both in English and Spanish. You just need to click on the corresponding button and those pages will come up for you. Or attending one of the public hearings so that you can give your feedback in person. So does anybody have any questions for me at this time? I know that was a lot. So probably a little numbed by all of it.
I'll wait to see if Continuum of Care members have questions. I have a couple, but I'd like to open the floor up first for others. Does anybody have any questions? Well, David, first of all, thank you so much. I know it's an extremely comprehensive process, and as the Continuum of Care, we want you to know that we are truly grateful for all of the hard work that goes into this and all of the resources that are provided through these funds. I asked David to upload, David Escobar from the Continuum of Care, to upload the plan to make it easier for our Continuum of Care members. So he's going to go to your links and do that. so that the folks can see the plan. I have a couple of questions.
Sure.
Since the continuum of care primarily focuses on working to address homelessness, in the plan, do you outline sections of data that show how many folks that are homeless have been assisted in the way that you report the MHA programs? Or is there a special section regarding that?
Are in the CSS section for the first year, we have given our housing and homeless programs its own subcategory. So CSS is divided into 4 sections. It's going to be FSP and general service development, and then outreach and education. And this year we added housing and homeless. So you get an update written specifically by our HOPE program, by Angelica, who wrote the whole thing. There is a lot of data in there. So there's a lot of data. It talks a lot about our outreach teams. It talks about the housing developments, a lot of our kind of shelter plus care and additional housing supports. So even if you just wanted that section, it's in there. If you go there just to CSS 04, it's a fairly decent sized portion of the plan, but still not big enough. It's small enough that I think you could probably read it fairly quickly.
Thank you. If it's helpful for RUHS to have support from the continuum of care, I know you're going through a survey process. If there's something you'd like us to do to take a support position, we do that all of the time. We're always in favor of trying to get more resources into the region. So if that's something that we can do as the continuum of care body, we'd be very happy to do that. So just wanted to mention that. And then this is just, I should know the answer to this question, but can you remind me, for especially for the programs that are targeted to our homeless population, are you guys entering data into HMIS, or are you having to keep all of that data in a separate system?
You know, David, you want me to jump in on that one?
I was going to say our homeless folks are going to be better at answering that than I can.
We do enter an HMIS, Karen. Yes.
Perfect. Yay.
Sorry,
I should have known that.
No, please. I'd rather have the information accurate.
So if you need us to do something, because the continuum of care is such a large body and this brings millions of dollars of resources, we'd be happy to do that just as part of your plan process. So
yeah, the state really looks at how much we've involved the community in the process and review of this document and getting its feedback. And feedback can span anything from, as you're mentioning, sustaining programs. So if there's programs and working with our department that you have found really successful and that you really want to be able to continue to see funded, mentioning that in the feedback process, whether going to that feedback loop or calling that phone number, really helps to show that these programs are what the communities want. And again, if there are areas in which you'd like to see greater development, if you'd like to see something more happen or dedicated towards, especially homeless consumers, please put it in there. It is read by our executive office. I create a summary of all the feedback at the end of the year. It is reviewed by our Behavioral Health Commission, which is that kind of volunteer oversight body. So they read every single question. Believe me, it's a day-long process with that ad hoc committee under the Behavioral Health Commission. They want me to go over every comment that was made, and we go over every single response. So that they become, kind of keep their pulse on what the needs of the community are based upon what was said during this process. So I guess if the first thing to do is just to participate in the process that I just mentioned, just going to that page and giving the feedback, or going to one of the public hearings and giving feedback.
Okay, good. We can talk offline perhaps about a way, because what I was thinking of, there's power in a lot of different people giving feedback individually, but I meant kind of more from the whole continuum of care. So because really these resources are extremely important and we're just so thankful for them. I do see that we had a question from Ayako. She's saying, can you elaborate on what resources available for homeless and who wish to live in sobriety-focused housing?
Marcus, do you want to go into more detail regarding that?
Sure. And I think in the interest of time, I'd like to give the short answer, but Ayako, if you would like the longer answer, I'm happy to be available offline. The housing that we have that's specifically where there's a requirement of sobriety, because obviously we have housing first type housing where sobriety is not required, but we have a system of care that we call recovery residents. And these are room and boards, but specifically room and boards that require sobriety and offer some supported services around that sobriety. There's roughly 300 beds at that level of care. They stay full all the time. And these are designed for our consumers that have gone to residential substance use treatment. Think things like what used to get called detox or rehab. People, as they're leaving those levels of care, if they're homeless and don't have a place to go, we use these 300, give or take, recovery residence beds so that people have a place to stay for up to 90 days. One, to support that continued sobriety, and two, to give themselves and their case manager additional time to work on a self-sufficiency plan.
Excellent. And Ayaka says, perfect, thank you. Do we have any more comments or questions? Well, David, thank you so much. We're thrilled to be a part of this process. And again, very happy. Addressing the issue of mental health is extremely critical to the quality of life in this region. So just truly grateful for all the hard work that you guys do as a team with all of these different program components.
We appreciate your support, and together, certainly we are meeting the best wellness for Riverside County in doing so.
Thank you so much. Okay,
Thank you.
we're gonna go ahead, David.
I'm just going to bow out now because I have another meeting to attend, so I'll leave you to it.
Okay, thank you. And now we have the exciting opportunity to hear about the Wellness Center. So we're going to go to agenda item 4.3, and we have our wonderful Marcus Cannon. Marcus, take it away.
I feel like the way you introduced me, there needs to be like music or something. I already feel inadequate to that introduction, but good afternoon, everyone. My name is Marcus Cannon, and I'm a Deputy Director with RUHS Behavioral Health. And Greg had asked me to share a couple things today. One was the Wellness Village concept, as well as to provide some updates about the Arlington Recovery Community, our Riverside Sobering Center, and the Restorative Transformation Center. So that is a few things to get through. I don't know if I could get a time check from you, Madam Chair, or from David. How long do I have to walk through these things?
How much time do you need?
I would hate to do it in less than 20 minutes.
You know what? Let me see. We should be okay, I think. This is like really important. So if everybody's good with that, this is the critical for us to understand. So go ahead.
All right, I'll do my best to go fast, but not so fast that it's nonsense. Are you able to see my screen?
Yes.
Perfect. RUHS, as many know, but just by way of introduction, is a joint county health system, and we operate the County Medical Center in Moreno Valley, 14 community health centers. These are primary and specialty care physical health clinics that also include dental that are spread throughout the county. The county public health department is under this umbrella, as well as the county behavioral health department. Behavioral health specifically is a large organization. You can see here we operate 79 sites of our own, and then through contractors, 140 community-based sites. We also provide staff who provide services on over 100 schools, and we serve over 60,000 unique individuals each and every year. I started with updates about the Arlington Recovery Community. This is a residential substance use treatment campus that we built in Riverside. There's 48 beds of residential substance use treatment, as well as 6 beds of withdrawal management. Those 6 beds of withdrawal management are for those consumers who need an even more intensive level of monitoring due to their potential risk for side effects from withdrawing from their substances. The program has been a great success. We stay full. We've been open for, time is flying, close to 2 years now. And it's a collaborative effort. Obviously, the county owns the location and funds the program. We have a relatively new provider there, that's Cedar House Life Change Center. We were closed briefly a few months ago and are now back open. same phone number to contact us. That phone number is here on this slide. It's 800-499-3008. For law enforcement, there's not a requirement of an advance call, as well as for our specialty behavioral health mobile programs. And within law enforcement, we include the City of Riverside's contracted outreach partners. So what we wanted is a no wrong door approach. We serve both male and female consumers, and we're open 24/7, 365. Program has been a really big success. We meet on a monthly basis with the City of Riverside as well as other stakeholders in the area to ensure that we're being good neighbors and that the program is effective. And we report out on data like this so that our stakeholders can see where are people coming from, where are they going to, consumer demographics and trends. As part of that campus, we built the first in the Inland Empire Sobering Center. Sobering Center is a location where someone can come while they're intoxicated, under the influence of alcohol or other drugs, and they can stay. Our goal is to have people not stay long. 6 to 10 hours is the goal, but they can stay for up to 24 hours in order to sober up. And there's some amenities on site. We give people food, they can take a shower, they can do their laundry. But the most important thing, certainly from our perspective, is the conversations that they have with alcohol and drug counselors while they're there. We've had a great success rate. Close to 70% of the people that are coming to stay with us are choosing to walk next door across the campus and enroll in longer term residential substance use treatment, typically a 30, 60, 90-day type program. The other 30% that are not choosing to do that, that are saying, thanks, but no thanks, I'm either homeless and I'm headed back outdoors, or I have a home and I'm headed back home. We still can keep their contact information and try to reach out to them to re-engage and encourage people to make that choice towards a life of sobriety. Again, this center is open 24/7, 365. We offer 15 what we call sobering chairs. I know this slide is small, but you can see they're recliner style chairs so that people can lay back and rest, but it's not a private room environment. Again, we report out on our data here in that same monthly meeting with the City of Riverside and other stakeholders, and you can see, one of the key questions is where are people coming from? And we specifically write into our contract with the provider that either the referring team who brings someone needs to also be responsible for case management to get that person home, or if someone is a walk-in and they've brought themselves in, that the provider will transport that person home. The Restorative Transformation Center is new. We opened just over a month ago. This is also in the Arlington area of Riverside. It's a 30-bed mental health rehabilitation center. It's designed to serve consumers with very significant mental health challenges. 20 of the beds are reserved for what we call incompetent to stand trial diversion consumers, and the other 10 are used by LPS conservatees or other specialty collaborative programs, things like Laura's Law or likely Care Court, when Care Court goes live in our county October 1st. This is, again, open 24/7. It's a residential facility. People live there, but it's not a drop-in center. It's not. It's by referral only. Telecare is the operator of the facility for us, and we've really generally been off to a good start. It's a beautiful building, and if technology will cooperate with me, I'd love to show you just a 1-minute video of what it looks like. I'm going to have to do my second. I always forget to include computer audio.
Hello, Riverside County, and welcome to the new Restorative Transformation Center in Riverside. Riverside University Health System Behavioral Health provides intensive, community-based psychiatric treatment to our most vulnerable community, We are working each day to improve our community's well-being. These individuals often have mental health, substance abuse, and trauma-related histories. They need engagement, case management, housing, and community supports to treat their disorders effectively. All support services that will be made available here at the Restorative Transformation Center. This facility will provide individual and group behavioral health treatment and counseling services. This will also lead to the creation of over 40 career opportunities within our community. The Restorative Transformation Center will be providing services in a safe environment to those who need it most. Here at the Restorative Transformation Center is where recovery starts. Lives will be transformed, families will be restored, but most importantly, this will be someone's safe place to start a healthier tomorrow. Thank you, community and friends, for joining us in this groundbreaking new beginning at the Restorative Transformation Center.
Thanks for letting me share about.
Hello, Riverside.
How do we get? There we go. So Restorative Transformation Center is exciting. It's an important level of care for us. And for any of you who care about criminal justice reform, it's a really important level of care because sadly, what can happen at times is people may have committed a crime and may have a mental health condition that's severe. And when it comes time for them to be tried for that crime, they can't really capably aid in their defense. And so legally, there's a process whereby they're declared incompetent to stand trial. And sadly, though, due to lack of funding at the state level and a lack of community facilities generally, what can happen is people end up stuck in jail in a sort of limbo, not able to be tried, but not also with a community facility to get out and get better, and ultimately have the DA either dismiss their charges or face their charges, but either way to have a path forward. And as any of you know who have a loved one with a mental health condition, the last place you want that person to be is stuck in jail. So having a resource to help people live in a community setting, a beautiful setting, eat good food, have caring, supportive professional staff and peer staff in order to get better is a really important level of our care, level in our continuum of care, and one that we're really proud of to ensure that people don't languish in jail with untreated mental health conditions. So I'm really excited and proud about that one and happy that we got it open and appreciate the partnership of all the other stakeholders. The big thing though, certainly that we want to share with you is about the Hemet Wellness Village concept. As David Schoen mentioned in his previous presentation, long-term, there's a goal. Certainly we would love to do one of these in each supervisorial district. The one in Coachella did not work out at this time. And so Hemet is really the one that we have going. What I'll share with you first is about the village concept itself, and then I can talk to you about where we currently stand with that path forward. So as you can see from the slide, this is a truly, when I say village, the site is over 10 acres. Think sort of like college campus. There'll be primary health care, mental health and substance use services, urgent care for both adults and children's age groups, as well as general outpatient mental health care for adults and children. We'll serve multiple populations, children, families, veterans. There's also green space, park space, as well as a community market. Some of the benefits of the project are positive economic impact to the city of Hemet, as well as the creation of over 600 jobs. It's interesting, as we have done community engagement for this project, I'll sort of spoil the surprise and say we've faced a lot of pushback in some quarters, and then also overwhelming amounts of letters and positive support and people reaching out to support the project. But the pushback that we've experienced sometimes is contradictory. We hear two things. One we hear is, oh, we don't need any mental health services in Hemet. We don't have anybody here who needs it. And so you'll see some data in this presentation to share that Yes, like anywhere in the world, people have needs for mental health support, they have needs for substance use, they have needs for primary care. And so what we try to do is show some of the services that we're already providing to reflect the fact that there is a need for these types of services in Hemet. What I can say is if you've been to any of our Hemet locations, none of them currently look like the JW Marriott. These are older buildings and they could use some TLC and love. And so that's why we need to integrate and centralize and provide this campus environment that's truly state of the art. And I say that because the other piece of criticism that we face or pushback that we face from other quarters is, oh, well, if you're already providing services in Hemet, why do you need to do something new? Can't you go away and do this somewhere else? So we're trying to address both of those concerns at the same time. There's a national index of community health that you can look up in Google in all your free time. It's called the Healthy Places Index. And the Healthy Places Index ranks communities on a continuum from 0 to 100, 100 being best and 0 being absolutely worst. Riverside County has a number of places, census tracts, that rank very low on that 0 to 100 scale. And Hemet as a whole ranks quite low. And this is a multitude of factors. It talks about access to healthcare, income, air quality, pollution, water quality, crime, traffic, et cetera, et cetera, et cetera. The very lowest census tract in the whole county is sadly in Hemet. And most of Hemet is in the single digits on that 0 to 100 scale. So this is part of our belief that this is really a ripe place to invest and to contribute and try to raise that score and raise the overall health of the community. What you can see here is numbers of consumers served in Hemet within the last 6 months. 1,400 for mental health, 300 specifically in older adult, 800 for substance use, 5,000 for primary physical care. So there certainly is a need in the community. This is a slide that talks about the crisis calls that we provide in the Hemet community currently. Between July 22 and March of 23, we responded to 574 calls, and you can see some breakout on that of 40 calls to school, 191 CBAT calls. These are our ride-along clinicians that ride with law enforcement officers, and some other detail here responding to Hemet Valley Medical Center, individual homes, and Hemet PD calls. We share this again to share that there certainly is a need for crisis response and intervening, helping to support people that are in a really low point in their lives here in the Hemet San Jacinto community. These are some of the programs that we currently have that serve the Hemet community. So you can see, again, there's a need across the spectrum. There's a need for mental health, substance use, school-based intervention programs, as well as housing. This shows you where some of the current programs are located. And again, if you're a consumer who needs multiple of these services, right now, they're certainly not within walking distance of one another. And we know that integrated care is good care, even for you or me. I'm sure in your life, I know in my life, I can share the experience of, I hear that I need to go see a specialist and I've got to drive to another part of the city, and it's very easy to procrastinate on that. So to be able to bring those things together is really important. My own primary care doctor gave me a slip for blood work. Go do your blood work. I think that was 10 months ago. It's still stuck in my cup holder in my car. And I haven't made it there because I couldn't do the blood work there at my primary care doctor's office. And at this point, I'm saying I'll just wait till my physical next year because I'm already closer to that than I was to last year. So the desire is to bring together integrated care. We know that taking barriers away is really the key to good care for any of us, particularly for individuals who are homeless or who may be low income. Back to the piece about our current facilities are not state of the art in terms of the physical plant. They're old and they're small and we've outgrown them. Anyone who's been to the recent buildings that we've built in the city of Riverside knows that when we do something, we want to do it right, and we want to contribute to the community and make it look beautiful. Our Riverside Crisis Campus won a beautification award. It also won a National Association of Counties Achievement Award. And our Roy's Windy Springs Wellness Center campus in North Palm Springs, we were just notified this week, is a 2023 NACO Achievement Award winner. So again, we want to reassure people who may have a mental image in their minds of a old, damp, gray, dingy, dreary building as, oh, that's what mental health looks like. That's not what we want it to look like, and we want to be a good neighbor to the community. Karen, I see your hand up. You're on mute though, Karen.
Sorry, I was just trying to clap for you. I'm a dork. I hit the wrong button. That was a clap for you.
All right. Yeah, well, we're excited, and again, we just really, it's really important to us to be a good neighbor and to leave a place better than we found it. And yet we've heard so much concern and criticism of, oh, we don't want mental health here, it's going to wreck the neighborhood.
Yeah.
These are drawings of conceptual design of what we want this village to look like, and we just finished with our architect this week the final drawings. As you can see, I mean, obviously I know everyone's taste is different, but to me, this would be a building that I would say, this looks nice. This is something that I would want in my community. Certainly the design intends to mesh with a Southern California sort of nature desert theme that is meant to be both beautiful, but also in keeping with our local flora, fauna, design influences of Southern California. This is a slide that shows you some of what the supportive transitional housing would look like. This is a aerial view of the campus layout. You can see that there's 6 major buildings. Going counterclockwise here, starting at the bottom right, there's a parking structure. Next to that, there's a community wellness and education building. Next to that, a children and youth services building. And then in the top left is urgent care services. Top center is patient and family housing. And then in the far upper right is long-term behavioral health care for people who need long-term residential behavioral health housing. Specifically on the services, I know you all can read, and so I will not insult you by reading bullet point by bullet point, but I would love to share a couple things on this. There's a children's mental health urgent care. Currently, there's no such thing in our county. There's also children's crisis residential, where children could stay for up to 14 days who need that. And then there's a family short-term residence. So currently, as you may know, there's an extreme shortage statewide of placements where both a caregiver as well as a child that needs intensive round-the-clock 24/7 behavioral health supports can stay. Those placements are almost non-existent in the state. And so we wanted to create one here on the campus that would be a home-like environment. We also obviously have all the primary care services that you can see in the top left. And we have recovery residences, like I mentioned earlier, as well as supportive housing for individuals who need a medium-term length of stay. And then the mental health urgent care for adults and children, crisis residential for adults and children, sobering center, as well as the full suite of outpatient mental health and substance use services. This is an aerial view. You can see that there's a desire to have this green artery through the center of the campus. The goal is that people could move from one end of the campus to the other, staying within green space the whole time. Walking areas, sitting areas, sports areas, activity areas, the kids' playground, as well as a public market and cafe. And again, that would be public facing. I'm sure most of you are familiar with the idea of a food desert. Sadly, it's sort of like the rich get richer, the poor get poorer. Those who live in a community that has low income also often don't have access to healthy food. And so we wanted to have a public facing market, not just to meet the food needs of the campus, but to provide an additional resource to help the community. There certainly will be veteran services provided out of this campus. We already serve veterans, both with mental health and substance use treatment. We have dedicated mobile outreach services for veterans. And we work closely with our county partners, such as the Housing Authority, as well as our nonprofits who serve veterans, to help people connect to VA services that they need. We also know that being a veteran can be very stressful, and people may have things like PTSD. Sadly, unfortunately, the cycle of PTSD sometimes leads people to use substances. And sadly, sometimes when people are using substances, they don't make their best choices. And we end up with veterans involved in the court system. To help with that, we offer 3 veteran-specific collaborative courts, and you can see that in the bottom right. We have a mental health diversion court, military diversion court, and a misdemeanor alternative placement. We also have veterans treatment court. This is where behavioral health staff work together with the public defender, the court, and the district attorney to come up with a plan of treatment so that someone can complete that and avoid fines, fees, jail time, and get on the path to recovery. The last thing we want is our veterans incarcerated for, punished essentially for a mental health condition or a substance use condition. What we want is to serve those who served our country and help them get better. Again, we know that the US population is not getting younger, and so we have specialty older adult, mature adult services that would also be provided there on the campus. We at Behavioral Health do believe that spirituality can play an important part in people's recovery journey. We're certainly agnostic about what that spirituality should be. We're not here to endorse any faith, but we know that a life lived with meaning tends to give people a sense of purpose and helps people overall in their recovery. So we have both staff and programs who are trained to help people connect with spiritual supports, and we do that already. And we work with Christian faith-based groups, Muslim groups, Jewish groups, other faith groups, Native spiritual groups. And again, we want to reassure the community that this is something that if consumers want this, we're happy to help connect and guide. But it's not something that's forced on anyone. It's certainly not anything that's a required part of treatment. Obviously, people are concerned about, well, gosh, if there's mental health services here, is this going to make my community less safe? And so this slide speaks to that. We would have dedicated private security, as well as we would, through contract, pay for sworn armed law enforcement officers, either through the Hemet Police Department or Riverside Sheriff's Department. There would be camera technology, of course, across the campus. Most of the campus would be gated, and we already have a successful track record of working with our nonprofit partners, our city stakeholders, and law enforcement stakeholders to have regular check-in meetings and ensure that our communities are being good neighbors. So in our minds, we know that law enforcement in any given city is already busy, and law enforcement will be the first ones to tell you that they might get a lot of calls for people who are homeless, or they might get a lot of calls for people who are homeless and have mental health conditions or have substance use conditions. That's part of our argument to say, yes, dear city, just like any city, people are already in your communities in need, and they may already be taking up time and resources from law enforcement. Let us bring resources to help reduce those calls. And that's really core to what we're trying to communicate. We drew these from the Hemet, City of Hemet's existing community plans and goals. You can see that there's a plan for economic development. That's the top in white is from the city's documents. And then the blue is our response, that this village would create over 600 jobs, and most would be contracted out to community-based organizations. These are also what we would call good jobs. These are jobs that are, professional level jobs of people who are going to contribute economically to the community and help create a career path for people who live in Hemet who may be growing up and looking for jobs and not wanting to leave their community, that that now there's an additional influx of professional level jobs in that end of the valley. Additionally, city has goals around smart growth and improved quality of life, and we believe that this village contributes to both of those goals and is in alignment with both of those goals. And we want to be really explicitly clear, this Hemet Wellness Village is not a homeless shelter, it's not a psychiatric hospital, and it's not a dumping ground. Here's some of the things the village will do: improve community health and wellness, create new jobs, be a desirable place to work, receive healthcare, and build new connection, increase community healthcare provider options, increase economic revenue, protect youth, and foster self-sufficiency and recovery. We've heard a number of times as a criticism that behavioral health has not engaged with the community on this project. And so we created this slide to share just some of the presentations that we've done. Just this week, I think we've done 7 community presentations that I don't even have on this slide yet. You'll also notice presentations with community electeds. We did receive a 4-to-1 vote of support in March of last year from the City of Hemet City Council. And we used that letter of support as part of our application for funding to the state of California. Since then, the City of Hemet has had a change of heart and has voted to rescind that letter of support. You can see where we've met with City Council members. You'll also note in that right-hand column where City Council members have declined to meet with us and don't want to be updated on the project. So we share this to say that we are committed to engaging with the community. And I know none of us have free time in our lives, and oftentimes City Council meetings go 3, 4, 5 hours. But if you'd like to watch some of the City Council meetings, you will see a line of people there for public comment, speaking and sharing about their need for mental health services in their community. So the public comment has been overwhelmingly positive. I do see a hand up from Gina Estrin.
Yes, I'm one of those positive, even though I don't live in Hemet. I live in San Jacinto, but I am there. And I do encourage people to look up both the city of Hemet and the city of San Jacinto post their recordings of their meetings. And I've been present to several of them. Also, I was hoping that there's a possibility you could come and make another presentation to the city councils yourself. I was there when another representative was there for Dr. Chang, and he didn't warm up the panel very much. And I think you're very good at this. And this looks all new to me too. Apparently this slide presentation is fairly recent, is it not?
It's been done for at least 20 minutes.
Okay.
Because I think that's when I started speaking. Yes, it is new. And Gina, I certainly would, connect with Dr. Chang and our executive leadership, but I'm happy to help however they want me to help. It's truly an all hands on deck, though. There's others who are doing much more of this work than I am. And I can say that there's a team of us here at Behavioral Health who spend probably 20 hours a week plus our day job just on the Hemet Village. So we're deeply invested in seeing it work. And we certainly hope that we can get to a place where the elected powers that be will support it.
Well, let me know if I can help it anyway.
Thank you.
Just to add on to that too, is Housing and Workforce Solutions too is a big advocate and works behind the scenes as well.
Yeah, we really appreciate that, Greg. And that's been the challenging part of all this is we've heard so much call for this for years. Everywhere we go, all we hear is we need more, we need more, we need more. And yet when we go to build something, it's like, it sounds great, but not here. And so that's the challenge that we're trying to overcome. I appreciate you listening to all this. I know it's a lot of information. To Gina's point, we can use all the help we can get, especially with the electeds of Hemet and San Jacinto, as well as with the County Board of Supervisors. So any connections that you have to those groups, if you're willing to go speak, write letters, have conversations, let your voice be heard. That's really what we need at this point. We have the funding for the project, and we behavioral health have the will to build it. And as Greg mentioned, we have support of other county departments. Really what we need is the support of local electeds. And so to the extent that you can help with that, we would be deeply grateful. We want to serve the residents of the Hemet and San Jacinto Valley. We believe that this is a really important concept. For those of you who follow the governor and his initiatives, you'll also know that this is likely coming in the years to come across the state of California. The governor has a vision for wellness villages. And sometimes what we've learned, as I'm sure you know, is you have two options. You do it locally and you get to have control over it, or you delay and ultimately the state forces you to do it or sues you because you didn't do it. And so we would like to take the option of local control and build something that's beautiful and that we're proud of and get it done now and be a first in the state innovator. Michelle?
Just from the city of Riverside's perspective, I want to thank the County Behavioral Health. They've been a great partner. They meet with us on a monthly basis. They're very transparent. They provide stats. They have all their stats on calls with us, and we're able to freely share information. If there's any issues, they get addressed, very quickly. And so if you need any support letters, I know Marcus, you and Ryan recently presented to our Housing and Homeless Committee, which is made up of 3 council members. So I could always reach out to them to offer letters of support and let us know if you need anything else as well.
We really appreciate that, Michelle, and we certainly will reach out. I see Gina's hands up.
Yeah, I forgot to tell you that unfortunately one of your proponents passed away from the City Council of Hemet. And so there's Shy, a person, and another person who I thought was in our ball court is not quite as responsive as I hoped. So I just wanted to give you a feel of what's going on.
Yeah, understood. And I had worked with Carly for years, both at an administrative level as well as literally, out in the park late at night on a rainy night kind of work. And so it was really sad to see her battle with cancer and to hear about that.
Okay, we're going to take one more question, if that's okay, Marcus. We do have several other items on agenda, and I would encourage you guys to do everything you can to be supportive. And Marcus, if you have other ideas of ways that the continuum of care can be helpful, please let us know. Adriana.
Yeah.
Mine's really quick, Marcus. Thank you so much for all the informative information. I just need to clarify if the number that you shared for the Sobering Center in your slide doesn't match the one when I researched online. I'm assuming the one on your slide is the correct one. Can you just confirm if what that number is again?
What I'm going to do is put it in the chat. Is that okay, Adriana?
That's perfect. Thank you.
Karen, this last slide had a 4-minute video. Do I have time for that, or do you need me to put it as a link in the chat?
Tanya, do you think we'll be okay? I know you guys need to do the monitoring tool, and we have a update on the point in time count. What? Tell me.
If it's a 4-minute video, it should be fine.
Okay.
Thank you,
All
Tanya.
Right.
Let me make sure that I'm sharing my audio. We had one other comment that came from a high place. Somebody saying, well, this sounds like just a resource for addicts. And so I wanted to share this, include this video. This is an existing program that we operate out of the Moreno Valley Medical Center, but we want to expand these types of programs. And I promise I won't even talk when the video's over. Tanya can just take over, or Karen. But we wanted to sort of speak to that when we hear, oh, this is just a resource for addicts. And we feel like this reminds us about who we're trying to serve here.
Well, I apologize. I thought you were done, Marcus. I'm so sorry.
I tricked you.
You did.
All right, here we go.
When I first came here about 5 years ago, we saw a big increase starting with patients that were coming in with opioid addiction. And as you know, opioid addiction and opioid deaths have been rising significantly in the
Of course, we have technical difficulties, right?
When I first came here about 5 years ago, we saw a big increase starting with patients that were coming in with opioid addiction. And as you know, opioid addiction and opioid deaths have been rising significantly in the
Karen, I apologize. I don't know what the problem is. I will put the link in the chat. I don't want to make people sit through my technical inefficiencies. But if you have 4 minutes at the end of this video, I promise, or at the end of our call today, you will not have dry eyes if you get done watching this video. So I would love to share about the work that Dr. Oshiro and his team are doing, and about the difference it makes in the lives of some of our moms and kids in the community. So thank you for letting me take so much of everyone's time today. I'll put my email in the chat as well in case there's any questions I can answer for people offline. And truly, in advance, we're so grateful for any support that you can provide to this project. It really is at a place of it may happen, it may not happen, and it really hinges on the opinions of our electeds. So thank you.
Thank you for all the incredible work that you all do to transform so many lives. I don't even have adequate words to describe how truly grateful I am. And we appreciate all of the information, Marcus, and just want to say thank you from the bottom of our hearts. We're going to move on now to agenda item 4.4, which is the monitoring tool and review and ranking policies. And we have Martha from HWS.
Hi, good afternoon, everybody. This won't take very long. What we wanted to make sure to go over is we have it's actually our scorecards and our program review and evaluation process policy. These were reviewed and approved last year. So what we anticipate doing is we want to continue to utilize the same scorecards and policy. We have spoken to Pat with our consultant and Joe Coletti, and they agree that these tools were effective, that they provided all the necessary information. So the only thing would be we would make adjustments based on the NOFA release for HUD CoC, and that would be the only change that we would need to make if there's any adjustments. But we would definitely let the CoC know if there was any other major changes required, but we would like to continue to utilize those at this point. Tanya, was there anything else you wanted to add on that?
No, just that we are trying to stay on schedule and in some ways get ahead of the game, because those of you who receive HUD Continuum of Care funding know what a strenuous process getting through that NOFO is. So as Martha said, we are recommending to maintain the same tools. Our HUD consultant has confirmed that what we have is good and align with the HUD requirements. So that's a thank you to you and of course the ad hoc committee that has met with us the last 2 years. And we promise to come back to you if there are any changes that need to be made once the actual NOFO comes out, which is anticipated in July or August. Thank you.
Okay, does anybody have any questions? There are links to the tools that were referenced in the presentations, and I just Tanya, you wanted to say something else?
Well, just that I do believe there's a motion. So if I'm not mistaken, Martha,
okay,
correct
I
me.
apologize. Yes, let me go ahead and do that for you. Okay, so just you can click on the link in the agenda and go into the Google Docs. You'll see all of the documents that were referenced by Tanya and the team. So basically, since there are no changes, I'd like to make a approve the revisions of the HUD CoC program review and evaluation process, policy, and scorecards as recommended by the Continuum of Care staff. Before, it looks like we have Greg and then Michelle that want to make comments.
I just want to note Susan Larkin's comment in the comment box about, looks like a duplicate question.
Can you
Okay.
speak to that question?
It looks like number 10 and 13, or it's the same, it sounds like. On the project scorecard.
Looks like Tanya's clicking, trying to.
Oh,
Take a
I
look
was
at it.
waiting to see if Martha was going to chime in. If it's a
Okay.
duplicate,
No,
then we
I'm
will.
looking there.
So
Yeah,
this
if
is
it's a
Susan.
duplicate,
It
we'll
is
go
a
ahead and
duplicate.
remove it. Oh.
Sorry, guys. It's regarding the SOAR SSI technical assistance.
Okay, we'll correct that. Thank you, Susan. Good catch.
Team effort. Well, I think it's a really, kudos to HWS and the team for being so transparent, giving you all who apply for these funds months in advance notice about the tool that is used for evaluation and scoring. So if you're not familiar with it, make sure that you familiarize yourself with it if you're planning on applying for funds. And if you're used to the tool, great. But this is just another example of how the team works hard to make sure that you all have information so that you can be successful not only in applying for funds, but making sure that they're properly managed. So kudos to the team. So if we're okay with moving forward, I'd like to entertain a motion to approve agenda item 4.4. Do I have a motion?
Motion.
Okay, Chris, thank you. Do I have a second?
Michelle Davis, City of Riverside, I'll second.
Thank you. Any abstentions or objections? Hearing none, the item passes. Okay, we're going to move back up to agenda item 4.1, the 2023 homeless point in time count results, and we have our amazing Tanya.
Thank you, Chair, and good afternoon, everyone. If you've attended the County Board of Supervisors meeting last week or the CBAG meeting last week, then you already heard this presentation, and I apologize. You can mute me and I will not get offended because I know you may not want to hear this information twice, but I know for a lot of you, you are eager to hear the results of the point in time count. And I do want to start off this presentation by just reminding everyone that we conducted the point in time count on January 25th. And we could not have done this effort without the support of all 28 cities in our county. Each of you, I know we reached out directly to each of our continuum of care partners to help us, maximize reach in all of our deployment sites, because we recognize the value of having experts on the ground who could help volunteers from the community go out and survey people who are experiencing unsheltered homelessness. The count also included a inventory of the people who are staying in our shelters. And to that end, I just want to definitely recognize all of you who are administering a shelter program throughout the county. We know that your staff are operating those programs 24/7, right, round the clock, and you are being flexible, creative in how you serve people, and the number of people that you serve in any given day in each year is overwhelming. So while the point in time count, and we can move on to the next slide, provides a snapshot of the people who are experiencing homelessness in our county, it is not meant to provide a full census like the US Census does of how many people are actually experiencing homelessness. So it's really just intended to provide a picture and help us determine, whether homelessness is going up, who is experiencing homelessness in our community. And so I just want to emphasize that most housing and homeless advocates will tell you to take this number and to multiply it by 2, 3, and sometimes 4. And the good part about our continuum is that we are working together to utilize our Homeless Management Information System, or HMIS. And so later during this presentation, I'll be able to provide you with how many people you are serving together across our entire continuum. So what did we find when we gathered all of the surveys across all of the cities, and of course, the unincorporated areas throughout the county? We found that there were 3,725 people that were either experiencing unsheltered homelessness or sheltered homelessness. This is a 12% increase in comparison to last year. But it's important to note that in 2022, we actually saw a 15% increase in the number of people who were experiencing homelessness. So this is the first time in a long time where we actually saw a decrease in the growth rate, or the rate at which homelessness is growing. So we saw a 3% decline in that rate, which tells us that we're doing a better job in managing homelessness in our community. When we looked at, the number of people who are experiencing unsheltered homelessness, that is 2,441 individuals, and then 1,284 individuals are sheltered. We should keep in mind that some of the reasons that we're seeing increases in the number of people who are experiencing unsheltered homelessness is largely because during COVID in 2021 and 2022, we had Project Room Key. And those of you who remember Project Room Key know that we, as part of the governor's response to the COVID emergency and wanting to create a shelter program for people who were seniors and also had chronic health conditions, we housed over 1,000 people in hotel rooms across the region. And so now with that program closing down and no longer available, we're seeing increases in our data. And so now we're looking at ways that we can be able to increase our sheltering capacity across the county. And I'll talk a little bit more about that later. If we jump to the next slide, what you'll see is that when we asked people why they were experiencing homelessness, the 3 main reasons were tied to an economic barrier. 27% reported family disruption. Usually this is due to a head of household passing away, or some kind of disruption, sometimes due to domestic violence, that results in a person not being able to maintain their housing. Secondly, lack of income, right? With the cost of rents going up and other inflation costs, being able to afford housing continues to be a challenge. And then 12% reported unemployment as a significant barrier. The other sort of telling news, which we've talked a lot about with you guys, is the number of people who are experiencing first-time homelessness in our community, which is at 21% and similar to what we saw last year. So even though we're not seeing an increase, this 21% is alarming, and we think is attributed to the fact that, especially in 2020 and 2021, we saw a lot of individuals or homeowners selling their homes, forcing long-term renters onto the streets, or having to access our sheltering systems for the first time. And before we advance to the next slide, I know one of the big questions that we always get is around, how are we doing in comparison to our neighboring counties? San Bernardino released their point-in-time count. They had a 26% increase overall. And then Kern County had a 22% increase. San Diego is expected to release their point in time counts either this week or next week. And then Orange County, we know, did not conduct an unsheltered count this year. They do it every other year, which is a practice that we plan to implement, so that in 2024, we will not be conducting an unsheltered count. We'll still report our sheltered count to HUD, again, which aligns with HUD regulations. Our plan is to use the data that we have now into the next 12 months to really focus on the business of housing people. We've made significant investments through your help to fund street outreach teams, to set money aside to support new housing developments. And so we want to work alongside each of you to really make sure that we're going through our by name list and facilitating connections to housing, so that in 2025, when we conduct our next count, we really can begin to measure our impact. If we move on to the next slide, you'll see that we broke out subpopulation totals, and I'll talk a little bit more about how we intend to provide or implement some targeted strategies for each of these populations. But you'll see that for veterans, we saw a 31% increase. Marcus Cannon earlier during his presentation was talking about some of the challenges that veterans experience. We know that when they're serving, they're often exposed to trauma during war. And so as a result of that, that makes it difficult for them to maintain their housing. Families with children, we saw a 12% increase. And this was not alarming to us, given that many of the street outreach teams, your street outreach teams, are reporting seeing more families with children living in their cars. I should note that of the 143 individuals that we counted, only 11 were actually living in their vehicles. The vast majority were staying in shelter. And so for that reason, we thank all of our shelter partners who are on the call, because we know when they're in shelter, not only do they have access to bed, food, water, but they're also linked to a case manager that's helping them resolve their homelessness. Interesting enough, but I think this just validates a lot of the work that we're doing locally to address youth homelessness and onboarding a homeless youth coordinator and having a dedicated youth council that meets regularly within the CoC to discuss how we serve youth who are experiencing homelessness in our continuum. We saw a 27% decrease in the number of transitional age youth. And then for seniors, we are seeing a 6% increase. Adult Services Division has been preparing us for this, right? They remind us regularly that 1 in 8 seniors in our county are experiencing poverty, and that we have a growing aging population that we need to prepare for. So if we move on to the next slide, here is where I really wanted to begin to talk about what we're seeing in HMIS, so that you can really see how the point in time count, again, is not meant to capture all. It's really just meant to provide a snapshot. In our current fiscal year, we have already served an unduplicated amount of 14,388 individuals. These are individuals who are accessing your programs, are being connected with your street outreach teams, are going into affordable housing developments that your teams are directly referring to. And I think it's important to note that of these 625, there were 625 more individuals housed in permanent housing this year in comparison to last fiscal year alone. That's a huge deal, and I definitely just want to clap. I know that's kind of weird on Teams, but I just want to thank each of you guys because we're doing more and we're doing more with your help. More people are getting service today in comparison to last year. And I think that's a big reason as to why we're not seeing the same rate of increases that our neighboring counties are seeing. Any increase is not good. But again, the fact that we had a decrease in our growth rate shows that we're maintaining. And I often reflect in the same way that you do, like this is just proof to the governor, to the HUD secretary, that if we're provided with more resources, we will continue to see declines in homelessness. So again, can't take any of the credit. The good work is all thanks to you. Next and lastly, of course, going back to the fact that we want to use this data to focus on housing more people. And so as a result of the increases we saw with the subpopulations we presented earlier, we want to launch 4 very specific initiatives. And some of these are already in place. We just want to commit to continue funding these moving forward. One is Valor 2.0. In 2016, Riverside County became the first largest county in our entire country to reach veteran homelessness. And City of Riverside hit that as well for that region. And so we believe that we can do this again. We're working with the VA Loma Linda to create 2 additional access sites within our county. So any homeless veteran who is identified does not have to go to San Bernardino or to the VA Loma Linda Hospital to receive a voucher. The goal is that they will be able to do that here in their backyard. Secondly, we're working very closely with Department of Public Social Services to ensure that any senior or family with children who is identified on the streets today can be fast-tracked to a housing choice voucher and ongoing case management assistance. For families, that's through the CalWorks Housing Support Program. And for seniors, many of you know that Adult Services Division recently, or at least in the last 12 months, updated their reach so that any senior today who is experiencing homelessness can be quickly served by them. And then lastly, an effort that we're currently working on now and negotiating into our agreements is we're coordinating street outreach coverage in the evenings and on the weekend, because we recognize that, someone's housing crisis isn't limited to specific time constraints. And we want to have the ability, the reach to be able to secure housing and even sometimes just connect a street outreach person to someone who is on the streets to build that rapport and to secure appointments for the following day to help them navigate this very, very complicated system. So with that, I'll go ahead and pause there and see if anybody has any questions for me. But truly, thank you. It's an honor to serve alongside each of you. We can't do this work without you. And with that, I'll go ahead and take any questions. Thanks.
Michelle?
Thanks for the update on the pit count, Tanya. You mentioned the 2 veteran centers that are going to be located in Riverside County. Have they already been identified, or you're in the process of identifying them?
We are in the process of identifying them. I know I held back because we're very close to doing that, but you can rest assured that once we have our plan fully solidified, we will be sending out an email to the entire continuum of care. And then I also know there's a veterans group that meets on a weekly basis. If you're not a part of that meeting and you want to have your teams support and provide reach and linkages to housing for veterans, let us know, coc@rivco.org. We're happy to plug you in.
Tanya, I was just going to mention that, when we discussed moving to a biannual unsheltered count, some of the good suggestions that came out of the Board of Governance meeting was in the off years an impact report that could be developed, because as you so eloquently showed us, the HMIS data, we actually can see a lot more people that are served through HMIS, and to be able to keep the focus on homeless issues and to keep the momentum and alignment with what we're trying to do with systems performance and our homeless action plan, that community awareness can still happen through an impact report, and all of that can be made possible because we have HMIS that can capture so much of that data. And I think the other thing is important just to comment is that we are on the list of the largest counties in the United States, because we do have 7,300 square miles to cover. So it is more difficult for counties this large to coordinate such a huge logistical effort. So, you know, just in looking at the monumental amount of staffing resources that it takes, I think HWS and even the other county agencies that support the pit count spend 5 months out of the year. So being able to do an impact report where we have all of this great data that's available through HMIS is, we're not going to lose any momentum. In fact, I think we're going to find that we'll be able to show how many more people are being helped and how many more people are in need. So just wanted to make those comments.
Thank you, Karen.
Does anybody else have any comments or questions about the data from the pit count? Okay. With that, we're going to move to agenda item 5, standing items. Let's go to the next slide. And I think we have Greg Rodriguez, who has some exciting updates for us. Greg.
Yeah, I'm going to go through quite a bit of slides, but I'm going to do this really quickly. So David, the next slide. Just a couple highlights from the state government. As you know, the federal government's not doing anything around housing and homelessness, and probably won't for a year and a half. But on the May revise for the governor's budget, it's pretty much status quo on what the homelessness funding will be. So the biggest one is the $1 billion for round 5 of HAP. We are hearing rumors of the possibility of Senate proposing some allocations, but we doubt that will happen this year. It's probably going to be postponed until next year. And then the California Association of Counties, League of Cities, and other legislatures are really emphasizing the need for ongoing funding and sustainable revenue. So if we go to the next slide, David. And with that, AB 799 originally was going to be a bill about making HAP permanent with a certain budget allocation. But in discussions we've all had with the governor's office, it would have been dead on arrival with a budget amount to it. So it's really focused more around the accountability portion. This is a plank not only in the at-home initiative through CSAC, but also is on the tip of everybody's tongue in Sacramento from the governor's office on down about the need for accountability, especially larger counties that have larger allocations and don't seem to be tackling the problem like they sure should. I'm going to go through the rest relatively quickly. AB 1053 is basically reducing financing costs for affordable housing development and looking at some alternative ways on how to do loans through HCD. AB 1085 would require the Department of Healthcare Services to seek federal approvals to cover support services for housing. That would be under a Medi-Cal or Cal-AIM waiver. Next slide, David, on AB 1413, excuse me. This is also dealing with the HAP program and would change it, change the jurisdiction of its operation to HCD, which does make more sense. Senate Bill 4 by Senator Wiener is basically allowing development projects on a by right basis on church and higher education properties, which would be very beneficial because a lot of schools and a lot of churches have a lot of land that they could develop on. That would be by right. There is some concern from local governments, but there is quite a bit of support in Sacramento. And then Senate Bill 43 is not really a housing bill, but it actually has to do with some changes around conservatorship, Lohr's Law, et cetera, expanding the definition of gravely disabled to include some more mental health acuity, which would give a little bit more teeth to something like a care court or the ability to conserve individuals. Senate Bill 45, next slide, David. Oh, you got it. Will establish the California Acute Care Psychiatric Hospital Loan Fund. We've been pushing Senator Roth on this. He's been a great partner introducing this. This would help us fund, ideally, a new behavioral health hospital in the county. And then Senate Bill 282 would require qualified health centers or our community health centers to allow 2 visits in one day. Right now, if you go in for a physical visit at a community health center, you cannot have a behavioral health visit on the same day. You don't get reimbursed in billing. So this would change that. We know, especially for our homeless population or those on the verge of homelessness, this, and Marcus even mentioned this, about the ability to get care right at the right time. And then Senate Bill 423 is by right. It is an extension of Senate Bill 35, which was by right settlement and through a ministerial process. And this would that was supposed to sunset. And so this would extend that as well. And then really quickly, David, on the next slide, this is legislation we're monitoring. All of those bills I just talked about have been passed out of their first house of origin, so either the state assembly or the state senate. And most of those have been pulled from what is called a suspense file and passed through appropriations, so they'll move to the next house. And usually when that happens through one house, they have a very, very good chance, possibly with some amendments, to pass the next one. And then what we're monitoring is Senate Bill 584. This is a pretty controversial one, about a 15% tax rate on short-term rentals that would go to workforce housing. You're in the short-term rental industry, tourism industry, and realtors are going to oppose this dramatically, and primarily just because of the high rate for it. And then Senate Bill 600, again, not necessarily for homelessness and housing, but seeing the amount of CalFresh, the minimum, go up to $50, again, more of a preventative measure. And as we know, many of our unhoused individuals, we actually link them to CalFresh services as well. And then the final page is 2-year bills. So a lot of times, if an assembly member or senator don't think they can get a bill through on the first year, they create a 2-year bill that they have more time to convince their colleagues, as well as deal with some amendments and changes in language. A lot of them too are around financial commitments. But the first is Senate Bill 7. This would require regional housing needs assessments, or RHNA, to include homeless as an income category and part of the housing element process. And then Senate Bill 37, I'm not going to read the whole thing here, but it's basically creating some funding for seniors for housing assistance and income assistance that are homeless or at risk. So thank you for the time. Sorry I had to go through that quick, but I'm going to be respectful of everybody's time. So,
Greg, that was awesome. I just wanted to ask you, since it sounds like most of these are still in motion, do you have any recommendations for anything we can do at the continuum of care level to provide feedback on some support positions? This is seems like some exciting stuff.
Yeah, so what I was planning on doing is bringing some of those recommendations to the Policy and Advocacy Committee tomorrow.
Great.
And then we can bring them back. So.
Awesome. Love it, love it, love it. Does anybody else have any questions or comments for Greg? This is such a valuable resource that he's providing for us, because there's so much to try to monitor and track. So we're very fortunate to have his support to educate us on this. Does anybody have any comments or questions? Gina.
It's kind of on the side. Greg, I noticed that you were at the National Alliance meeting earlier, which had all the statistics for 2023 on the PIT count and everything. Is that something that we should spread to everybody? That's just my thought and comment.
You dropped off there, Gina. Did you mean the NAEH webinar today?
Yes.
Yeah. Yeah, it's a link we could serve. I think the thing is we had better data really than they did, and we're going to distribute that when we get the full report. Theirs was more on the national level and doesn't go down in demographic as wise. I'll get the link and we can send it out. But I think you'll be really impressed, Gina, when we get the full point in time count report out.
Yeah, I did notice that the numbers that were just shown now are different than what was in the national report.
Yeah.
But I'm thinking by having a comparison, we can show either how good or how bad we're doing relative to the rest of the nation.
The other jurisdictions, yeah, that's a great point.
Yeah. Okay, thank you.
Okay, we're going to just quickly zoom through the rest of the items. You can see on the slide before you, there our committee reports in the Google Docs for HMIS and the Youth Advisory Committee. And we are having our Policy Advocacy Committee meeting tomorrow. And you heard what Greg had to say. So please feel free to join in on that important meeting. And then we did have an opportunity to sign a letter of support for the city of Lake Elsinore for encampment resolution grant. So let's go ahead and move to the next item. You can see that there is an annual performance report for the city of Riverside for the PSH project that you can have access to. And then moving on to the next. Do we have any calls for agenda items for the June 20? Oh my gosh, almost the end of the fiscal year. Holy cow. Do we have any calls for agenda items for the June 28th Continuum of Care meeting? If you don't have any right now, you know how you can get them to us through coc@ribco.org. So let's move to the next agenda item. Does anybody have any announcements? Okay, well, we will move to this last. I do have an announcement. Hopefully you all saw the invitation. I'm super excited. It's finally here. We have the grand opening community celebration for our Shelter Navigation Center. Our city council did give a name to it. It's called the Harris and Hope Center. So we're not calling it a shelter. It's much more than a shelter. It is Shelter Navigation Center with an on-site FQHC clinic. So we'll have medical care, mental health treatment, substance use treatment, dental care. It's pet friendly, all kinds of wraparound supportive services. And we've linked all of our permanent housing resources to it for tenant-based rental assistance and our permanent supportive housing programs so that people will have a fast track from the streets to shelter and into housing. So super excited about it. We'd love to see you all come and join us in this community celebration. This has been a few years in the making as we went through phase 1 and phase 2 renovations. So we're excited to have more resources to help people. And just want to give a shout out to the county for being such a great partner with not just the city of Corona, but all the cities across the region. Both HWS and behavioral health. Just truly, we couldn't do it without the county. So you guys are amazing. Thank you. Does anybody have any? Gina, you have a question?
Yes, actually, because I just looked at this and I don't know the address. And I noticed little things like that on many of the flyers that come my way. Either there's no address or no date or time or something. So
yeah, it's in the, if you look in the email that David sent out to the whole continuum of care, it's in there.
Okay.
So just look for that email. It's at 1 p.m. and it's at 420 Harrison in Corona, and it's listed in the email. Adriana.
Yes, thank you. I just want a quick announcement. We have our back to school open house. Say Family Justice Centers will be having an open house at the Riverside Center July 19th from 5:30 to 7:30. I will attach the flyer to the chat. Also, on the same month, we will have the Indio open house, which is also on July 26th at the same time. The purpose of that is for partners, elected officials, community partners to come out, tour the center, and get an experience on how our victims come through the center and receive services. So we'll have many partners as well. So I'll attach it and people can promote it with all your networks. Thank you.
Thank you. Any more announcements? Okay, well, you guys are troopers. It is 5:11. The last thing you can see is all of the upcoming meetings that are listed on the agenda. Just want to thank you all so much for your active participation and helping to be a better region with all of the resources that you bring and us working together to make a hope and a future for all of those folks we're trying to help. So I hope you guys have a great rest of your evening. Thank you again. Have a good night.